I'm afraid not. I don't see that happening in the near future. I actually see it increasing because I am seeing it increasing. Even I do statistics on the number of patients I see in my clinic, in our clinics, because we are developing a food allergy center. It is just increasing more and more. So hopefully in the long run, when we find out biologicals, and there are, you asked me for other therapies and other important things happening, there are biologicals, newer biologicals that direct molecular weapons called cytokines. And instead of a broad-based umbrella type approach where you attack everything you know, which steroids were doing, we're now targeting individual cytokines and chemicals, and seeing if that helps shut off certain pathways and improve the condition better, more because we want to prevent side effects also of the medication. So if you're targeting therapies, you can individualize it. Also, we want to be able to identify patient profiles, who would benefit from a particular therapy rather than the others. There are some newer biologicals that were actually mentioned in the plenary session I just attended, targeting anti-allergy molecules. Not IgE, which is the allergy antibody, but the products of some of these mechanisms, like anti-IL-4, anti-IL-5, anti-IL-13. And a few of them, one of them recently got approved, the mepolizumab, by the FDA. So they're trying to target eosinophilic asthma and see the severe asthmatics who may need it. And then there are a couple of other similar therapies, which one of which actually helps atopic dermatitis, called dupilumab, which has shown a lot of promise. For instance, if that works to prevent atopic dermatitis and heals the skin barrier, then maybe we'll have less food allergy, and go to what you were asking, will we have less in the future? It will take us a while to get comfortable with the use of biologicals. They are very expensive, obviously. Now, that's a big problem. Second, we don't know much about them, and it's a new product. People are always nervous. You want to be able to tell your patient, oh yeah, I know what it is, don't worry, I can take care of you if there's a problem. But those definitely show promise. I mean, there's a lot of science happening, and there's one more drug. There are a few more drugs coming out which are targeting these eosinophilic type phenotypes. So they do show promise, and they may change the way allergy is occurring and affecting people. We always want to raise awareness, because we have found, despite the amount of education we're doing, people do not come to the doctor for allergies. You know, if you have hay fever symptoms, they like tough it out, for instance. They think the medications are harmful. They worry about the word steroids, even though they're topical, inhaled steroids, or, you know, skin on the skin. They get worried about the word steroids because it has a bad connotation. And so because of different issues, they don't even seek care sometimes. So education awareness is definitely important. Even when they do come to seek care, they sometimes do not know the difference between a trained allergist who may be board certified versus somebody who practices allergy, who may be practicing in different ways that are not necessarily following guidelines, and sometimes get differing treatment approaches that have side effects, and you know, then they get disheartened about the allergy. And so we do need good education on good websites to go to, good a list of physicians who are trained and qualified and have passed stringent exams and certifying you know, criteria. That would be helpful. So there is a problem there. Also, there's important for them to know that in certain conditions like food allergies, they need to carry their medication, injectable epinephrine. And it is something that's hard to do on a daily basis, to have that injector always with you, because it sort of reminds you constantly that there could be a bad outcome, and people don't want to think like that. Also, it's just inconvenient. Sometimes you're rushing somewhere to a ball game or to the Royals game or something, and you forget. But think about the peanut exposure you can get in a Royals game. So it's really important to have that with you on standby. So yes, from education to awareness, there's still, we're doing great stuff, but there are a lot of myths that need to be dispelled. In fact, there are doctors who tweet about the myths and do the myth buster thing, and I think that's very helpful. There's a lot of, as many people have food allergies, many more think they have food allergies and they don't actually have, which is a big downside because they're restricting their diet and that of their children in a great manner and causing harm, because it leads to, just because you're chubby, it doesn't mean you're healthy. You still need the vitamins, you still need the other things. And we get some of these children who have been on restricted diets and are malnourished and did not need to be because they did not have allergies, because the testing was wrongly interpreted.